Welcome back. It's Dr. Jim, and I have another important topic related to the COVID-19 outbreak. This is what older adults and seniors need to know. According to the experts and recent research findings, individuals aged 60 years and older are twice as likely to develop serious health complications if they are infected with COVID-19. Those who have chronic health conditions like heart disease, diabetes, and lung disease, they are even more vulnerable should they become sick. This information, please believe me, isn't meant to incite panic among older adults. As a gerontologist, I would never do that. But it is to help protect them and to reduce their risk during this outbreak. It's about being smart and taking every precaution you can to stay well and healthy. Coronavirus, or COVID-19 as you're hearing it everywhere, is actually a family of viruses known to cause respiratory symptoms very similar to seasonal flu and the common cold. Depending upon the individual, symptoms can range from very mild, almost unnoticeable, to severe, and usually cause dry cough, which doesn't produce anything, fever, breathing problems, and aches and pains that you did not have previously. Why are older adults more susceptible? It's important to remember that they are more susceptible to a lot of different things, not just COVID-19. Older adults are more vulnerable to the seasonal flu, to the common cold, to certain types of infections. So it's not just COVID-19. So it is not surprising then that they would be at a heightened risk of serious health complications if they come into contact with the virus. Here's something else older adults need to know. If they do become sick, their recovery time will probably take longer. Those individuals who develop symptoms like cough, fever, shortness of breath, pain, pressure in the chest, confusion, bluish lips, or a blue tint to your face may have a more difficult time recovering due not simply to age, but underlying health conditions and sometimes multiple health conditions that seniors and older adults may already have. If symptoms are present, it's particularly important to know that older adults seem to be less likely than younger people to have a high fever when they are infected. I don't know if that is getting out in the news or in the public. Seniors simply may not have a fever, but they may have other symptoms that appear to be flu-like or due to a cold, but they may actually be associated with COVID-19. So if they do have symptoms like these, they should contact their healthcare provider. They should let them know exactly how they're feeling, be very specific about their symptoms, and then listen for the healthcare provider on the phone to follow instructions to get to the hospital, the ER, or somewhere else, and reduce the risk of infecting other people while getting to the hospital. That's very, very important. What about staying home or places to avoid? Those we hear about a lot right now too. And I'm not a huge fan of it, but I know it's extremely important. It probably is best to stay home as long as you can for long periods of time. For a week or two, maybe a little more. That doesn't mean you can't get outside and get some fresh air or walk your pet or whatnot. You could do other things like that, as long as you're okay, as long as you're well enough to do things like that. What it doesn't mean is to become isolated to the point of depression, to not continue to take care of yourself. Instead, avoid social gatherings. You know, we heard of 50 people, then I heard 25 people, then I heard 10 people. A week or two ago, it was stay away from gatherings of 200 people or 100 people. Now it's down to about 10. But it's going to be easy to avoid malls and movie theaters and traveling because as of the time of this recording anyway, a lot of retail stores are closed. Some restaurants are closed. Theaters are probably closed or are closing. Travel, just heard this morning, is really restricted. So it's not going to be tough to not go to those places, but it might take some adjustment to staying home. It also means being more mindful about going out to places where there might be a crowd. Social distancing, you've heard about that. That's important for seniors and older adults. One of the best ways to avoid contact is to practice social distancing, which just means staying 6 feet or more away from people. It is important to get out for groceries and prescriptions, but do it carefully, mindfully, and cautiously. If people are visibly sick, just stay away from them. If they're showing signs of COVID-19, keep your distance. Tips while going out or staying in. Wash your hands as much as you possibly can. Carry around a little bottle. I was so surprised the other day. I found a teeny tiny little bottle of hand sanitizer. Took a picture of myself and put it on Facebook, and it's like jackpot because that was the only one there. But remember, your hand sanitizer should have at least 60% alcohol or more. If you're going to go grocery shopping, and I've seen it, I haven't done it yet, wear gloves to the grocery store. But when you leave the grocery store, you know, if they're rubber gloves, peel them off and throw them away because they might be infected. Don't peel them off and throw them on your dashboard or your car seat and drive home with them. Don't shake anybody's hand. Hey, what's up? How you doing? Hello. Have a nice day. We'll get through this. If you have visitors in your home, take the same precautions you would as going out. Have them wash their hands. Remain at a distance. Don't shake their hands. And make sure, above all, that they're not visiting you while they're symptomatic or sick. So, preventing the spread is what this is all about. If that virus doesn't have anywhere to jump, it's going to die. Wash your hands for 20 seconds. Sing a little jingle. Happy birthday to me. Use warm water and soap. Use alcohol-based hand sanitizer if you're touching surfaces like I am all the time. Regularly clean and disinfect frequently touched areas like light switches, countertops, toilet handles, faucets, the door handle to your car, you know, the gear stick. I mean, there's a lot of surfaces. Everything's a surface. My briefcase, I came home the other day and my wife Annabelle's like, spray that thing down. Take your shoes off. Disinfect the bottom of your shoes. Even I'm not thinking about all these things. Final thoughts. Older adults, especially those who have chronic health conditions like heart or lung problems, diabetes, are at an increased risk for experiencing more severe reactions to COVID-19, and it might take them longer to recover once they do become ill. Older adults, you do not have to go into hibernation like a bear. And if you're not sick, and you can, go outside. Enjoy the weather. If it's raining, get some rain on your face. If the sun is shining, get some sunshine on your face. As I am filming this right now, I've opened my window. A lot of experts are saying crack the windows around your house, by the way. Let the air ventilate and circulate, not remain stagnant. And birds are chirping right outside my window. I'm talking about COVID-19 hour after hour after hour after hour. And the birds are chirping and they're making me very, very happy because that's new life. And we all are going to have new life again. So take your pets for a walk. My dog, Buddy, hey boy, he was bad. He was barking during one of my filmings, so I had to throw him out. Actually, Annabelle brought me a beautiful frittata. And I don't know if I can, whoa, really, really good. That's why you want it in. So I'm going to take him for a walk. I'm going to take Kitty for a walk. They need exercise. They need fresh air too. So get out. Be mindful when you're going out to shop. Be mindful about keeping your home clean and happy and positive. Do things you haven't done for a while. Read books, watch movies. My goodness, I have stacks of books and movies I have to get to. I have guitar lessons that I want to get to and piano lessons that I want to get to and spend time. I want to play board games with Annabelle and Karina. So have fun. Stay in contact with your family. Make sure other people are doing well. But remember, reducing and stopping the spread of this terrible virus is the fastest way we're going to get out of this together. I'm Dr. Jim. Keep coming back because I will definitely have more topics, more education, and more information as it continues to evolve. Take care.